webinar series of our research mini-series. And so I probably should start off and introduce myself. So my name is Whitney Nichols. I am a second-year medical student at the Frank H. Netter School of Medicine at Quinnipiac, which is in Connecticut. So I am a part of a working group with Alex and Melissa. And so we kind of put this together for you guys. So without further ado, I'll go ahead and get started. I just like to put this here because I just want everyone to know that this is certainly a safe space. No matter where you're from or what your background is, you can freely speak your mind. And I ask that everybody is respectful to each other, and so that we all can be here. We can all learn from each other. Okay, so the next thing, I just want to go over the overall goal of the series since we do have some new people here. So our goal is, one, to increase member awareness of research. And so if you're part of the Student National Medical Association, you already know that there are lots of benefits here for you as part of this organization. But if you're not, I really encourage you all to look at the website, www.snma.org, so that you can find all of the different opportunities for you that are out there. Specifically, this series is to help you identify research opportunities, and then 3, to provide you with tools to successfully design, execute, and present the research findings. So if you've been with us for webinar 1 and 2, you know that we have a goal for you to be able to present at the Wilbur C. Jordan Forum, which I'll talk about. But again, we have an end goal for you. And so we always start with a target. And that's what our target is. So an overview of the series. So our first 2 series, so the first one we talked about the types of research. Webinar 2, hopefully you all were there. We talked about mentor-mentee relationships. And so we had a dynamic panel. And so if you haven't got a chance to watch those 2, those are gonna be fundamental for you to understand the rest of the series. And so those are posted on the SMA YouTube channel. So definitely get a chance to watch those. And you're just in time for webinar 3, which we're gonna be going over how to read an academic paper. And so from perspiration to inspiration. So hopefully you will be inspired at the end of this and feel a little more comfortable as it pertains to reading an academic paper. As I stated, so the Wilbur C. Jordan Research Forum, it's an opportunity for SMA members to be able to display your scientific competence and for you to display any research accomplishments that you have. It's open to all members, and what you have to do is you have to prepare and submit an abstract of your work and be able to display a presentation for the annual medical education conference. So I just put that here so that you guys have the information, but you can certainly read more about it on the SNMA website. Okay, great. So for those of you who are new, so how this normally goes is we have a 30-minute lecture style as of right now. So you guys are stuck with me for the next 23 minutes, and I'm going to give you some background information about what you need to know in order to be active and be able to participate in the panel, and to make sure that hopefully what the panelists say doesn't go over your head, right? And I also want to just level the playing field. We have some high school students, college students, and medical students on the line, and so I'm hoping that we can stay right in the middle so that everyone gets what they want, and hopefully gets the information that they need. The second part is for our panel, which I'm sure is why most of you joined. And so our panel consists of student researchers, principal investigators. We have academic professors here today to help you figure out how to read an academic paper and what skills hopefully that you can take away from this to make you a more effective researcher or future physician. Okay. So academic papers, how to find and read them. So major goals for today. 1, I'm going to show you how to use a major clinical database. 2, I'm going to show you briefly how to conduct a literature review. And then 3, I am going to briefly show you a couple points to help you read an academic paper. So for those of you who aren't in medical school, so everything is going to be with learning objectives. I think even college is a while back, but everything's done through learning objectives. So my first learning objective for you is that we're going to identify relevant levels of evidence in literature and associated resource types. You're going to gain an ability to evaluate literature and evidence sources for relevance and quality. Hopefully gain an ability to conduct a literature review using academic databases. And then number 4, I want you to gain an understanding of how academic papers are constructed and where the relevant information that you need for whatever project you're doing and where it is, and so how to access that information. So for those of you who, I always give homework assignments, and so I'm hoping that everyone brought this homework with them to really help them today. So as of right now, we're hoping that you have solidified an area of research, and if you have no idea what I'm talking about, go to the SMA YouTube page and look up the different types of research. We're hoping that you begin to finalize your project schedule. So if you started when we first got going, we're hoping that you're getting closer to that. And we hope that you started to look at PubMed and get an idea of how the interface works, so that today will be kind of building on the fundamental knowledge that you already have. Okay, so without further ado, let's jump right in. So what I was taught was that there are 5 levels of identifying evidence, and the 5 A's. And so I put 4 here because I'm going to teach you how to do the last one. But when you're looking at research articles, you want to certainly assess, right? And so what does assess mean? So you want to say, okay, is the research article going to answer the question that I have? What questions do I have? So do I need to start off and get basic introduction or background information? 2, is it asking relevant questions to what you're proposing, right? And so, for example, if you're interested in minority research, right, and you're looking at a research article, and it says that there were 100 participants, right, and of the 100 participants, 5 were African American, and your study is on African American health. Is that going to be the best article for you going forward as you're trying to match the information that you have and what the goals that you have? 3, what are you hoping to acquire? So I'm hoping that's something that you're thinking about as you're reading the research articles. I'm hoping to acquire this information. If it's not there, I don't want to read that, so that you're also not wasting your time. And then this number 4, this idea of appraisal. So being able to put all of these things together and say, yes, I want to certainly jot this down for my references, or no, I think I'm going to find something else. And so how to be able to do that quickly enough in order so that a systematic review or your literature search doesn't take 2 or 3 years, right? So you're hopefully, for those of you who are actively attaining PhDs and you're defending your dissertations, fantastic. 3 years, that's fantastic. But if you're a busy medical student, you're a busy college student, hoping to give you some tips in order to shave that down some so that it doesn't take you years to be able to do this. So the next thing that I wanted to talk to you guys about is this idea of what is really a good place to research, right? So there's a difference between popular and scholarly, right? So popular, I know I don't want to trivialize in any view, and so I know that you all know that Wikipedia is not a great source for you to find information. If you didn't know that, Wikipedia is not a great source for you to find information, right? Wikipedia is considered a popular source, right? As well as some magazines, some news articles. It's normally geared to the general population. And what that means is that anybody can, and why Wikipedia is so bad is that anybody can come off the street and write anything in Wikipedia, and it doesn't have to be peer reviewed. And so you don't want to do research on anything that experts in the field haven't reviewed, because you don't know how to validate that information, right? Popular information is not structured. And so I'm going to walk you through what a structured research article, everybody follows the same format. It's the information you're looking for is going to be in a certain format. And that's what helps with scholarly papers. We talked about the peer review, and then there's no citations. So citations are extremely important because it helps you say, okay, this didn't make sense, or where did they get their information? And so then you can look at the citations and then build some background information to help you get to the point of where you feel like, okay, now I can understand this article. So scholarly is normally going to be Journal of Medicine. And so I put a pin there because I want our panelists to certainly talk about that in their experience. But in my experience, it's normally a Journal of Medicine. There's normally a narrowed audience. And so, when you start to do research, you're going to be in a very prestigious, I would say, group of people. And so having this information, it's going to be targeted to you, and it's going to kind of weed out a few other people just based on the structure. Again, structured format, it's going to be peer reviewed, and there's always going to be citations. So if you look at something and you don't see citations, maybe halt, take a breath, and maybe find a mentor to ask some questions there, because we want to make sure that you're getting the information that you need. Okay, so acquiring information. So if you were here on our first webinar, we talked about the differences in the sources, and I just want to put this again here because it's really important when you're doing research. So understanding that your primary sources are going to be, if you're taking organic chemistry, right? Your primary sources are your lab notebook. It may be a conference poster that you had an opportunity to hear someone lecture on, or maybe the journal articles for a randomized clinical trial. It's actually what the person wrote down. The secondary sources that you're going to see is you're going to see what you see in kind of your textbooks. They're taking a bunch of the information that people did for the primary resources and writing it in a way so that it teaches you what the general trends are. And then your tertiary sources, I wrote systematic reviews here twice because I particularly love systematic reviews, because a systematic review takes a bunch of information, analyzes it for you, and then regurgitates it into you in a way of where normally it's in like in one journal article format. So you literally can, somebody's doing the work of reading 20 to 30 journals for you and putting it in a way in which it's understandable for you. However, the systematic review is going to be answering their question. Doesn't necessarily mean it's your question, but again, it gives you a kind of a starting point of where to go. Okay. So next, so this idea of this filtered background, unfiltered information. So at the very bottom is where you have these clinical databases so if you're in medicine, you'll see physicians use UpToDate, Clinical Key, Access Medicine, or your textbooks. And so that's kind of like when you need to figure out, okay, what is how do you treat an infectious disease in pediatrics? These are the databases that physicians are going to go to, because it's taken the information that's higher up and kind of filtered it down. And so you're going to get your expert opinion. I'm going to give you guys a very high level overview of PubMed, but PubMed is going to be kind of your unfiltered primary sources, Scopus as well. And I put Google Scholar here. People have different, sayings on Google Scholar. I prefer PubMed, and then I'll normally use Scopus. And then the filtered information, that's where you're going to find your systematic reviews. You can find systematic reviews in PubMed, but there's something called the Cochrane Library. I wish I knew this, but it literally has rules for how systematic reviews have to be conducted, and you can find them in the Cochrane Library. So I know this is a general overview, but take a screenshot of this so that you can kind of get a good idea, so that if you're looking for, hardcore facts of how to take care of patients, or what your physician may be using if they pull their phone out, they're normally using Access Medicine, Clinical Key, and UpToDate. That doesn't mean that they're going to have research studies there, but if you want to know like the prevalence of something, it very likely may be in the textbook, or for people who have expert opinion and getting the background information. Okay, so what to consider while you're thinking of these, right? So the first thing is, I'm always thinking about accuracy and validity, right? So, okay, your author's presenting you information. Is it objective? So let's say that I want you to buy ice cream during the summer. Very, very arbitrary. If you're doing a research on ice cream being bought during the summer, you want the author to present it in a way in which they're giving it to you objectively. So they're just giving you the facts about how much ice cream is bought. In the very end, they may then try to tell you, based on our research, we are now pushing that this is how things should be done. But you don't want to read that in the very beginning. That's how you know that the author may or may not have some type of something to gain from the research. And so you definitely want to be careful reading that. The second thing is you want to look at the authority on the article. So is there a research institution that's affiliated with it? Is the author kind of like going rogue right on their own? They're not affiliated with the research institution. They're kind of just writing an opinion article. And so then, if you're thinking of opinion, that's one person's opinion that may not reflect the whole scientific community. So that's something that you want to think about. Again, kind of objectivity. And so something that's important to me now, and I'll go over this, is the conflict of interest or disclosures. And so, for example, if you're reading a research article and the author has stock in a pharmaceutical company, and then they're pushing that drug, right? Some people in the research community may say, hey, I don't know about this. I don't know if I trust this. And so certainly most authors are very upfront about their conflicts of interest, but there's things to take into consideration as you're objectively reading and trying to figure out if you want to include them in your literature review. And then lastly, currency relevancy, right? So if you're looking at something cutting edge and top of the line right now, if you look at a research article that may have been published on it in 2011, medicine's always changing. Research is always changing. So you want to try to find articles that are as current as possible, depending on the topic. You can get background information from older articles, but again, you want to make sure that you're getting as up to date as you can. Okay. So now what most people have been waiting for, so the PubMed search. So here's kind of a 4-level overview of kind of what I do and how I find information for PubMed. So the first thing I do is the use of terms. So I want to narrow down my scope. If you just type in, so I'm looking up colorectal cancer in the African American community. If I just type in colorectal cancer African American community, I guarantee you 20,000 articles are going to come up in all different dates. So you want to narrow them down because I'm sure you don't want to read 20,000 articles. It's going to take a very long time. The next thing I do is for recency of the study. So one of the things that one of my mentors told me is I normally look between 5 years. And so I know that if it's 2020 now, I'm going to look for research that happened between 2015 and 2020, because normally that research, that data hopefully isn't super stale, and that if there's any new findings out, it'll be in the newer articles. And then if I have to expand that search and go a few more years back, it'll normally be in the site. They'll normally cite the background information for me. And so I can just kind of pick that information out from the cited page. The article type, again, I'm going to just plug systematic reviews here. Again, if you don't know what they are, please look them up. I consider them to be very helpful. But if you're looking for something with primary sources, a systematic review, you may start there. And then the systematic review normally sums up primary sources. And so it'll kind of give you all the primary sources that they looked at to give you a starting point. And then for me, abstract availability. I always am going to read an abstract before I read a paper, because I don't want to waste my time, and I don't want to read the entire paper and say, okay, that is not what I was looking for. That did not help me at all. Okay. Then let's talk about the article in the abstract format. So this is the standard structure format that I was telling you guys. So the background, you're going to get the insight of what you need to know. It's going to tell you why the study was relevant. So if you're looking for certain pertinent information, you'll find it in the background section. The methods, they're going to tell you who was in the study, how did they recruit them. And so if you're looking to duplicate something, it's going to be in the methods section. The results are going to tell you what was statistically significant. So it's going to tell you what important differences were there among study groups. And then what did that study find? And then the conclusion, you're normally going to find any limitations that the article had that you should take into consideration. And you're also going to, the author's going to tell you, based on their results, what they think either the future study is going to be, or what they think that the next step should be. And so if you're looking for a project and you're interested in something, sometimes the author lays it out there, right there for you, and it's a good place for you to start. Okay. So the research question. So I wanted to walk through this in the 9 minutes that I have with you guys and do a PubMed demo of what it's going to look like. So our goal is to create an intervention to target colorectal cancer screenings in the African-American community. So the first questions that we're going to have are, what are African-American patients' attitudes, beliefs, needs, and preferences when it pertains to colorectal cancer screening? Work has already been done. And then what do I need to take into consideration for my intervention? So here I'm hoping that you guys can still see my screen. So here's what PubMed looks like. And for me, I always do an advanced PubMed search. And so I'm going to type in, I practice this, I would type in African Americans. I'm going to click add here. I'm going to type in aged. Then you can see and, or not important words, because I want African Americans and aged. So I'm going to put and here. I want colorectal neoplasms. I just learned what that is, and I'm a second-year medical student, so don't feel bad. And then early detection of cancer. So you guys can kind of see, as I was getting better doing this, you're gonna get quite a few in the very beginning. So I got 123, but as I got closer and closer, I got a fewer number that I was willing to read. And so I'll click search here, and you can kind of see on the interface, this is the year that I was telling you guys about. And so I always go 2015, 2020. I do that because I know that anything that happened here, I'm assuming that these articles wrote them, they cited that information in their background. So I don't have to go through all of these studies here. I'm normally going to click abstract here to make sure that it has an abstract for me to read, and it's going to narrow down a few other things. And so you have systematic review here, and then the article type. And so just because I practiced, I already selected an article out of here, and it was addressing the low colorectal cancer screening in African Americans using a focus group to inform development of effective interventions. And so here's the abstract. It's very short compared to the article, and I have an analysis of this, but it has all the information I need about the actual article. And here I also point to no conflicts of interest. So I'm feeling pretty good about that. I'm feeling pretty good about the author. Additionally, PubMed really does a lot of work for you. It can cite information for you. So I click citation, it would pop up. And then, for example, if I want to know, okay, this validity of this author, I can click this author and it'll literally pop up a bunch of the articles that they've written. And so this particular author, has 38 results. And so again, we're hoping that everybody is May FP. It may not be, but you can see that a lot of the gastroenterology is what is popping up for this author. You see kind of some disparities work here. And so I'm kind of like I'm feeling pretty good about that. And so that's something that I'm feeling pretty good about. And I'll just keep it there. The other thing I want to point out here for you all is that I kind of read the abstract to get what I need, and then I jump to the conclusions, right? And so why I do that, or the discussion, is that I want to know, okay, I read their results, I read their findings. What am I supposed to make of that? I'm not an expert in this, and so I want to know what do they recommend that further research happens. I also want to know their limitations, and sometimes they give a very broad overview of limitations, so that I want to take into consideration while I'm reading this article. Another high level point for anybody who's in medical school, I look to see what grants supported them. So if it's an NIH grant, I know that they had to have a certain level of caliber. Again, I'm going to put a plug in here because I know that Dr. Richards and I talked about that. But we want to talk about the ingrained, sometimes there's ingrained racism as it pertains to filing for grants, publishing in top journals. And so I definitely want to leave that plug there for Dr. Richards to go over that, since that's something that she and I talked about. And then lastly, the references. And this is what I was telling you guys. I mean, 2012, 2011. So you don't have to read, you can go back and read those things, but more than likely, they put in a citation here in their introduction on what you can take from that particular article. And so if that's something that you're interested in, or you want to know more about that, you can go back to that to get that information. And so this is a kind of a beautiful way for you to kind of figure out where the starting point is for this literature review that you need to do. In addition, PubMed can help you do similar articles. It can tell you what other articles cited this paper, and so if it's not the most relevant, you can find, okay, like somebody else put a plug in for this article. This may be something that I'm also interested in looking for, and so it can just help save you time overall. Okay. And so we did that quick demo. And so here, forgive the colors, but I just wanted to point out, so how I read the abstract. So as I'm going through here, I got the basic information that I think I wanted to know. So I knew that African Americans had a high burden of colorectal cancer in America, and that there were lower screening rates than whites. So I said, okay, great. I didn't know that, now I know that. The next thing I'm looking for is, what was the aim of this study? So what should I be taking into consideration while I'm reading it? So the aim of the study was to conduct focus groups with African Americans to determine preferences for content and mode of dissemination of culturally tailored colorectal cancer screening interventions. Great. So that was my question. I wanted to know that. The next thing I'm looking at is there were 45 people who were recruited. They were 75-year-old African Americans. The mean age was 54. So if I was looking to have a study of younger patients, this study may not give me the information because it doesn't reflect the same demographic group. That's something I want to take into consideration. Additionally, the results. So what were the results? That there were perceived invasiveness of colonoscopies, there was fear of pain and financial concerns. So if I want to make an intervention, those are things I need to take into consideration. The best ways, based on this particular study, was that media and medical providers provided a lot of information, and that participants suggested that the screening be through educational commercials, billboards, or influential African-American public figures, right? So if this older group, Patti LaBelle may be, I mean, no offense to, but Patti LaBelle may be, who they were talking about, influential African-Americans, right? But if you're a younger group, they may resonate with Patti LaBelle, but Beyonce may be closer to what this age group. So you want, again, taking these things into consideration. And then lastly, the conclusion. And so this is what I also pay a lot of attention to. And so it clearly says here that they emphasize the increased risk of African-Americans to employ media outlets and then to address race-specific barriers. And so if that was a question I had based on this one particular study, this can give me information. Again, I don't want you guys to think, okay, this one study says it, I'm going to run with it, but this gives you information that this one particular study had. And so it gives you a place to start so you're not starting from scratch. And I'm running out of time, so I did want to plug in a couple other things. I don't have time to explain this, but screenshot this. Something that was particularly helpful for me is called Jane. Jane can help you find the top authors on the topic that you're studying. They can help you find relevant articles. And if you're looking for a journal to publish in, they can show you based on like what information that you have, what may be a good match. It'll help you read articles that were already published by this journal. One, use page navigation to your advantage. So I kind of showed you guys a little bit, but PubMed has cited by. Cited by is extremely helpful. It'll also show you similar articles. And then lastly, something that I learned the hard way, use a reference manager. Don't just use, Word can help, but I try to use Mendeley, RefWorks. I've never used BibTeX, but I've used Mendeley and RefWorks so that you don't have to wonder when you're citing information. It's already there for you and you can kind of just plug it in from there. And so I know I'm running out of time, but lastly, I'm hoping for your homework that you will begin a literature review. You'll hopefully solidify your mentor. I'm hoping that you guys found a mentor if you're getting close to that, and that to be ready for our next panel, that you're starting your project proposal. So beginning to think about elements that you want to include in that. Just a hint, if you are working with patients, you probably want to start thinking about what's called an institutional review board for approval. It's extremely important so that you don't get kind of halted at the front door. So next steps. So our next upcoming webinar is going to be how to write a research proposal. And then our next one is going to be abstract writing. Okay, so I am finished with my part. I will now turn this over to Alex to introduce our wonderful panelists. Thank you guys for listening.
Yeah, thank you so much, Whitney, for doing that. My name is Alex. I'm a post-baccalaureate student at the University of Texas at Dallas, and I'm also a part of the working group that me and Whitney and Melissa have going on to kind of make this project happen. Melissa has posted in the chat what the links to the last couple webinars so that you guys can check that out. And without further ado, I want to thank our panel for being here. And I'm going to start off by just introducing each one of us, okay? So our first panelist is Dr. Victoria Richards, and she's an Associate Dean of Curriculum and Associate Professor at Carleigh, Illinois College of Medicine. And then our second panelist is Dr. Melissa McCartney, who is an Assistant Professor at FIU for Florida International University. And then we have Umaru Bari, who is an MD PhD candidate at UT Southwestern Medical Center. And then we have O'Leary Eximo, who is an MD candidate at Frank H. Netter School of Medicine. And so I like to always start off with like having our panelists just kind of talk about their background and just kind of how they got to the point that they are, and also talk a little bit about the research that they're working on as well. So if Dr. Richards can start. I don't think we can hear you.
Is that better?
There you go.
Okay. For some reason, the microphone switches to two different systems. Anyway, it's nice to be here. That was a wonderful presentation. It was absolutely awesome. So, so I just started here at the Carleigh, Illinois College of Medicine. It's a school of medicine that focuses on engineering. So it's an interesting overlay of medicine and engineering to find real world solutions to some of the clinical problems out there. So I'm not doing active research, although I am a pharmacologist, toxicologist by training. And I've kind of been on a trajectory from starting in research, you know, doing a couple of postdocs and then wanting to teach, but not having those opportunities to teach, and kind of put me on this trajectory that led me to this administrative position. I was at the Frank Netter School of Medicine. I was the third faculty member there. I helped open it, so it's kind of wonderful to kind of have a closed loop here. The area of my the interest that I'm interested, the interest of research for me is medical education, particularly in finding the right pedagogies for med students to ensure their success. And then also with pharmacology competencies, because I'm sure you're aware of adverse effects of drugs are considered a very challenging cause of mortality and morbidity in this country. So that's kind of my soapbox in terms of research and focus.
Thank you so much for that, Dr. Richards. If I can have Dr. McCartney go next.
Sure. How's my microphone? Is it working?
Yes.
Okay, perfect. Hi, everybody. Thank you for the invitation. It's wonderful to be here, and thank you, Whitney, for that great presentation. My name is Melissa. I'm an assistant professor of biology at Florida International University. I have kind of a unique position in the biology department because I study biology education and how we can do a better job of teaching biology and helping our students gain an identity as a scientist and as a biologist before they graduate. Before that, and what got me interested in primary literature is I was an editor at Science Magazine for about 5 years, where I started really getting into education work. And I worked on a project where we were trying to make the articles in science more accessible to a general audience. So that included, it was basically an annotation project where we went through and defined glossary terms, explained methods, linked out to other web pages that might help understand the research better. And that was really, you know, a very active project for me, and I was really engaged in it. But the problem was, because I was at a nonprofit, I couldn't really do any research on whether or not everything we had built was changing anything. So that's how I ended up back at FIU, because I'm in a position now where I can do research. And I do, part of my research portfolio is on primary literature and how we can do a better job incorporating it into introductory, mostly biology, but a little bit of chemistry as well. Because I think being able to read a paper is a very important practice as a scientist, whatever kind of scientist you go on to be, whether it's at the bench or at a nonprofit or a medical doctor. And I think it's very valuable to get that into the intro courses so that you can build that skill while you're in college instead of trying to figure it out, you know, after you leave and you use some of that support from your undergraduate institution. So I'm happy to be here. I'm looking forward to questions, and thank you again for the invitation.
Thank you so much, Dr. McCartney. I'm going to move on to Amaru. I can find you here.
Yeah.
All right, gotcha.
Hello, everyone. Can everyone hear me? Can you hear me? Hello, my name is Amaru. I am fifth year now, MD PhD candidate at UT Southwestern Medical Center. Yeah, it's been a journey. So throughout my 5 years of medical school, I have been involved in both basic science research. Currently, I'm in the molecular microbiology department, studying leishmaniasis entry into macrophages. Also done global health research, neurosurgery research, academic medicine research, so different types of research. But one of the things that all these have in common is, of course, assessing journals, assessing the impact of different papers, and utilizing different papers to basically write your paper overall. And I recently did my qualifying exam, where I basically had to read at least 100 papers. So I think, it's interesting just going from I can't read a paper without just falling asleep to actually being like, wow, this is actually exciting. So I think everyone's saying the same thing. It's a skill. No one's born learning how to read even the simplest of papers. It's just it's a necessary skill for whatever you will do in medicine. But yeah, thank you guys for having me.
Thank you so much, Amara. And I'm gonna do Ulu next. If I can find her video. Okay, there you go. Gotcha.
Okay, hi everyone. Thank you very much for the invite, and that was a wonderful presentation, Whitney. Great job. So a little bit about myself. I came to the US a couple of years back, and I came in for my master's in public health, which I did at Tufts University. My concentration was clinical epidemiology and biostatistics. So while studying there, I worked with some of my mentors on some NIH-funded grants on substance abuse, hepatitis B studies. We also did some stuff around sexually transmitted infections. After that, I went on to work for like a biomedical company, and I was basically in charge of their clinical trials, and we were looking into oncology trials for cervical cancer specifically. I did that for about a year or two, and then I decided to start a company in my home country, Nigeria. And basically what we do is try to look into clinical research and work with international organizations that are interested in developing innovative solutions to clinical problems in developing countries. So I still do that, and I'm currently a second-year medical student. I have an interest in orthopedic surgery, so most of my recent work has been geared towards that. So I do mostly musculoskeletal disorders, arthroplasty, and then I'm also passionate about ethnic disparities, how it relates to clinical outcomes. So I've had the opportunity to present at several national conferences. I recently had a presentation last week at the American Congress of Surgeons. I'm basically just talking about ethnic disparities in surgical outcomes, and I think it's a really timely topic, and it's something that the medical community needs to start taking like really proactive strategic steps towards figuring out. I mean, we know what's going on, we just have to figure out how to solve the problem. So that's a little bit about me. I'm going to stop talking now.
Thank you so much for that. So now what's going to happen is basically we're going to move into the section where I ask you guys different questions, and just in the interest of time, I'm going to point the questions at certain panelists. And so our first question here is, in your opinion, what is the significance of being able to read an academic paper as an academic doctor or future physician or researcher? And I'm going to start with Amaro. I think you're on mute.
Sorry, I was on mute. So I would say there's multiple different ways to answer that. First, if you're going to a specialty, for example, like surgery, actually many specialties, sometimes the answers are in academic papers. So you're basically attending or seeing, like, okay, so what do we do here? Like, you cannot be like, oh, I don't know. You can basically, some of these things you can look up into papers and see how they did it. There's articles that basically talk about different guidelines, for example, transfusion, for example, for surgery lamps, so different things like that. So that's one. Two, if you're writing a paper or, doing a case report, systematic reviews, anything like that, you have to be able to read a paper and assess that paper. And sometimes that's how you get ahead in the academic world, is by writing papers, publishing papers. And for you to publish a paper, you might have to read at least 50 different papers just to write that one paper. So it's very, very important that you're able to extract information. It's not just reading it just to read. It's how can you extract that information and know what the authors are trying to basically persuade you to accept, or what they're trying to get across. So that's the second part, I would say. So the first part was basically sometimes the clinical answers are in the papers. Second one is, writing the papers. And the third thing is, medicine and science is ever changing. If you are to keep up with any of this stuff that is happening, last year's papers might be already too old. So you have to constantly read, especially like in the basic sciences or any other field. You have to be able to synthesize information and see how other people were able to get at the data. For example, for me, every single time there's a new protocol, there's new machines, there's new antibodies, there's new, all these stuff that's every single time new. So you have to be able to read a paper and be like, okay, this is how they did this method. How can I use that method to answer my question? So yeah, it should be integral. I would say, read a paper, one paper every single day, whether it's in your field or other fields, because sometimes the methods that they use in physics might be important for you in microbiology. So it's important to be versatile. It's important for you to, just, it's a skill. Keep it going, keep it reading. Sounds a long-winded answer, but there's multiple different ways of answering that.
Okay, thank you so much, Amaro. I would like Dr. McCarthy to go next.
Oh, so it's the same question. Why would you need to read a paper? Okay. I think it's a communication skill. And I think, that's how everyone in science communicates, regardless of the field of science that you're in. And I think as a student, when you begin to read more and more scientific papers, you'll also learn how to write more and more scientific papers, which is probably what you'll be doing, when you enter your professional careers. And I would also have to echo Umaru and say that science changes every minute, and really reading papers is really the only way that you'll stay up to date, not only with the current discoveries in science, but also the current controversies in science. Because the more we learn, the more we question things we already know, and I think that would be very important too, regardless of whatever professional career you find yourself in.
Thank you so much, Dr. McCarthy. And Dr. Richards, could you also talk about this a little bit?
Sure. I mean, I would echo what has been said before, but I think as a society, we all want to belong. And when you start speaking the same language to the group that you want to belong to, that's going to help. And when you read a scientific paper and you understand what has been argued for and argued against, when you're part of that group and that same discussion comes up, you can support your argument for and against because you've read the information. So I think that increases your credibility if you can support your argument by referencing, again, a leader in the field. So when Whitney showed the author who had several publications in gastroenterology, if you're in a discussion about gastroenterology and you mention that author, that gives you credibility in that group. And so I think it's key to be able to dissect a paper, understand what is being discussed and what's not being discussed. I think it's very important with what Whitney had talked about is the title could be fantastic, but if you do a quick word search and what you're looking for is only in the references, then that's a problem. So you have to be able to parse it out, dissect it, and recognize what you're looking for. And did you get what you're looking for? And so if you can do that and you're talking to someone about the subject, it's going to help you move forward in that field.
Thank you so much for that. Whitney, was there a question in the chat? Did someone have a question?
I think it was just a general question about whether they can direct questions to any of our presenters. And so I think that would be appropriate to answer that question. So if you have a specific question, just at the presenter, and then we can read it off for Alex to integrate it.
Yeah, it looks like Tyler Sanford has a question, so maybe we should have him.
Thank you. May I?
Yeah, go for it.
So I always find, especially with reading a lot of research papers, is that it's a lot of information coming at you and it's a lot of information to actually digest. So I asked the presenters, are there any specific systems of note-taking and organizational methods that you would advise for just being able to culminate all this different information that you're taking in to easily pick out a paper that you're looking for and being able to cite it anywhere throughout your paper?
I'll take that first. So again, starting with your question, whether it's a research question or just you want to know more about a topic, there are keywords that you should look for. And so I find it very helpful. Again, if you look at the abstract, do a quick keyword search. Is what you're looking for in the abstract? Do the same keyword search for the entire article. Again, has it shown up once or twice? Then that could be an issue. So when you are presented with a whole lot of information, you have to figure out how to dissect it. Kind of like a test question. I mean, there are red herrings. You can just gloss over stuff that, yeah, this is important, this is important. But if you have in your mind exactly what the target is with a keyword, whether it's, I don't know, a clinical condition, it might be a technique, it might be an outcome, it might be, you know, a country or a state. If you have those keywords at hand, you can go through a lot of data quickly.
Thank you so much, Dr. Richards. Olu, could you speak on this as well?
Just to add to what Dr. Richards said, I think she wonderfully addressed the question. Sometimes it might be good to like just, if you don't have enough time, maybe just look at the introduction and conclusion of the abstract before you start, and that will give you an idea if it's relevant or not before you start looking at the methodology and other stuff. Sometimes I also would, if I find a really good paper, usually on PubMed, it's going to tell you this is a list of similar articles. So sometimes that list is usually very helpful. Instead of going through the whole gamut of your search, I just go through like what are the other similar articles that are being recommended. And that's a good way to kind of narrow the information that you're looking for. In terms of note taking, I know that Mendeley is a reference manager that really helps with to put everything together, and you can take notes, you can have the PDF, you can annotate on the PDF, so it makes your life easier. Generally, I create an Excel spreadsheet. Usually when you are doing a literature review, you would need to have that anyways. So I just create an Excel spreadsheet. I have like the introduction, the methodology, the results, and the conclusion. And for every paper I read, I just put in like 1 or 2 lines that kind of summarizes what each of those sections was addressing, so that if I come back to it a week later or 3 weeks later, I don't have to read the paper again. I just have the information right there and I can pick up from where I stopped.
So I have one thing to add. So the way I learned within the past thing, how to, basic science papers are more difficult to read than I would say clinical papers, because it's more intense and sometimes very specific to the field that you're in, and the methodologies are spread. So one, it depends on the type of paper you're reading. So look, if it's community health, if it's academic medicine, if it's global health, it depends on the type of paper. Maybe they have different approaches to them. But also the type of journal. For example, Nature, all the work is probably in the supplementals, but the paper itself is like 4 pages. It's very condensed, very, very condensed. Like other journals, like for example, a journal of virology, it gives the author the opportunity to write whatever they want, however they want. Like it's different types of paper. So you have to acknowledge the type of paper that they have, whether it's like a high impact journal with like only four pages, or if it's like a lower impact journal with like 20 pages of paper worth paper. So those will tell you how you may need to read that. But the second thing is, this is how I read papers now. Like the first thing I do is I read the first paragraph of the discussions, because sometimes that summarizes mainly everything, that what they did in the methods, what they are interpreting the data as, and it also summarizes part of the introduction. And after that, I read the first paragraph of the introduction, because sometimes that summarizes what they were trying to look for and what were the questions that they are trying to anticipate and stuff like that. And then I read the abstract. Why I read the abstract third is because sometimes if it's a heavy journal, the abstract, they try to condense stuff. They try to appeal to the editor. They try to make sure the editor like really takes their paper seriously. So, and then after that, I read the rest of the paper. If I have a small amount of time and I'm just like scouring for different papers, I just basically the discussion, the perspective discussion, the last introduction, the abstract, and then the rest of the paper. But each paper, I would say, have different things that you should look for. First of all, you should look for the biological question that is being asked. That's very important. That's something you should go in whenever you go. You're like, oh, this is what the biological question is, and you highlight it. The next thing after that is the hypothesis. What are they trying to answer, or what do they believe the answer is? And after that, the approaches, so the methods. What are tools that they're using, and things stuff like that. So highlight those. After that, assumptions that they made and limitations, very important, because then it will tell you a lot about what the author is thinking, as well as what they know is probably not the right way of doing this or things like that. And then data and results, you'll find that in the results section. And this interpretation, how do they interpret it? The interpretation is different from the data. The data is basically whatever they found. That could be, data is always, what I've learned is the data is always correct. Interpretation could be wrong. How can interpretations be wrong? It could be wrong due to your methods. Your methods could be wrong, but whatever you found is whatever it is. And also, I would say, be careful when you look at how authors interpret the data, because they could be confounding things that they haven't discovered, or there could be other reasons why they found that they don't really know at the moment, especially for basic science research. So, and then the last thing is the conclusion and future direction. The future direction will help you out. If you're going to PhD world, the future direction will later help you when you're trying to find a topic for your qualifying exam and things like that, or for your research yourself. The future directions will help you figure out what has not been answered, because I'm sure whoever the author is, they made an exhaustive list of stuff and trying to figure out what's next for their paper. So that's all I would add to that part.
Thank you so much, Mauro. I actually think you answered another question that we have, but I want to go ahead and try to summarize it a little bit more. So, and Mauro kind of talked about this a little bit, but as someone reads a paper, is there a certain mental checklist of things that they need to be looking at? And could you guys give maybe 3 or 4 examples that we can take away that would be mental checklist things when they're reading? How about I start with Dr. McCartney?
Sure. So I get this question a lot, how should I read a paper? What should I look for in a paper? And I think everybody is going to find their own style. So every panelist that answered that last question had a different way of reading the paper. And that was different from the way Whitney presented hers. And it's different from the way I read mine. So I'm sorry to be the bearer of bad news, but you're going to have to start reading some papers and a little bit and finding kind of your own style. So I go right, I read the abstract and then I go right to the discussion. And the part that interests me the most about the discussion is what questions are still unknown, because I usually do my lit searches when I'm writing grants, and that's what I need to know, what questions are still out there that are ripe for researching. So I don't know, I would be hesitant to give you a checklist, because I think every time you approach a paper, you're coming in with a different reason and kind of a different agenda of why you're reading that paper and why you picked that particular paper. So I think maybe the better question is not so much what's the checklist as you go through the paper, but more what's your end game? What are you trying to do with this paper? Are you trying to brush up on your knowledge? Are you trying to write a grant? Are you trying to prepare for some kind of exam? I think maybe think more about your end game and then kind of think about what you're trying to get out of the paper. Is it a fact I'm trying to learn? Is it the next steps I'm trying to think about? Is it a controversy I'm trying to settle? That might be a better approach than actually checking things off the list.
Thank you so much for that, Dr. McCartney. Anyone else have anything to add?
So this is Mauro. So I would say it depends on the type of paper and the type of field that you're in. If it's basic science, hypothesis is definitely very important. If it's hypothesis of biological system that they study in, the methods might be important. For example, is it like a screening? That's the paper that you're looking for. Are you trying to, and it depends on what you're trying to look for. If you're trying to do a qualifying exam, then you're trying to basically create an entire project within that. And if you're doing if you're writing a grant, then if you need methods and stuff like that, then you it depends on the type of stuff. There's no way of just creating a list of things that you need, but it depends on a lot of stuff. The things I told you guys before is basically my step whenever I'm reading a paper, like a basic science paper. I mean, the biological question, the hypothesis, the approaches, the limitations, the data and the results, and the interpretation of the paper. Those are things that I look for in the paper. But if it's if I'm trying to actually find ways of doing experimental methods, I may go straight into the methods and be okay, so this paper did this is what they found. okay, how did they find this? Okay, I'll go to the method and I'll study the method section. And the method section will be the ones that I actually delve into the most than anything else. But that's different when I'm doing my neurosurgery research. When I'm doing my neurosurgery research, I'm more of looking for, you know, discussion sections. I'm trying to find how basically they interpreted the data that they found and what that means for the field of neurosurgery, for example. Global health, similar to that, is how does this play in the context of other countries and this country. So it depends a lot on what are you trying to find. So I wouldn't say like a mental checklist, but it depends on the type of research that you're trying to do and why. If you're writing a paper, discussion sections. If you're like grants and stuff, maybe the methods. So it depends. There's no specific checklist, and this is where having a mentor will come in because they will guide you specifically for whatever you need at that moment.
Okay, thank you so much, Mauro. Dr. Richards, I think you know.
Yeah, I would just add, I know that it is kind of difficult to have a checklist because everyone has their own rhythm. When they get to reading a lot of papers, you'll develop your own rhythm. But I've found with myself, the first thing that I do and I have to do is I have to check my biases. When I'm researching something or I'm looking for information, the first thing I have to tell myself is to not let anything about the surface bias me. So coming up through a couple of postdocs, doing my PhD, you know, my mentors, my advisors, my principal investigators, they funneled a lot of biases to me, particularly around different institutions. They'd have a lot of different things to say about, oh, that institution, they're terrible, they do terrible research, or a particular journal, they'll say, no, ever read this journal, it's terrible. So I find myself, when I click on an affiliation, if I look at you know, a research group, the institution, I have to say, don't let my past experience bias me. I still have to read it. I can't just ignore it because I've got some bias towards either the topic, the school, or the author. But I do think that when you see a title of an article, I tend to quickly dissect it. If it's snarky, I think I can detect snark, but that takes skill. You can detect someone overinflating what's in the article based on the title of the article, and then looking at the abstract, is it connected or is it not connected? And I may not continue any further if there's no connection between the title and the abstract.
Thank you so much, Dr. Richards. That was really, really good. I'm going to go ahead and move on to the next question. Does anyone else have anything that they would like to add?
Just a quick addition to what we already had. Avoid papers that make bogus generalizations. There are some papers that they try to explain, oh, we did this, we did that, probably like maybe sample size, maybe 50 people. And then you say, so from this, we can conclude that the entire US population would behave in this certain way. That's not true. So papers like that, you need to take them with like a grain of salt and say, how did we arrive at that generalization? You know, sometimes some papers, the data and the explanation in the discussion section is just all over the place. Like they say one thing in the data is saying one thing, their discussion is another thing, and it's just all over the place. Usually the more papers you read, you begin to know which ones are really good and which ones are, you know, not too good. Also with time, one of the parts I also look at is the data analysis. Like, are they able to explain the purpose of explaining your methodology is that if someone else picks up your paper, they can replicate what you did and plus or minus get plus or minus the same results. Like if you say you put 2 drops of a solution into another 2 drops of something, we should be able to do the same thing and plus or minus get the same result that you got, assuming all the conditions are the same. So if the methodology is not that easy to follow, then that's also a problem, because then you ask yourself, how useful is that paper to you anyways? So.
Thank you so much, Olo. I'm going to move on to.
Can I add just one more thing?
Yeah, go for it.
Just really quick, because going back to the bias piece, and if I see something that's misspelled, if I see one instance of a misspelling, I will not read it. And if I see instances where maybe graphics are in a PowerPoint, I won't read it. And again, it might be my bias, but those are some of the things that I also look for.
Okay. Okay, so I'm going to go ahead and move on to the next question here. Did anyone in the chat have any questions, Whitney? Any more questions in the chat, or are we good?
No, we're okay, but I did want to ask Dr. McCartney a question. Why is it important to look at conflicts of interest?
Great, conflicts of interest. So the example I usually use with my students is if you're reading a paper telling you that sugar is really good for you and we should all be eating more sugar, and you start to think, this doesn't sound right. And then you go look to see who sponsored the study, and Nestle sponsored the study, right? Nestle has a clear conflict of interest in telling us that we should all be eating more sugar. So I think I have to admit, I am not always good at doing this, and thank you, Dr. Richards, for the reminder to look for these things and think about your biases when you go into a paper. You should always look at the funding source. And I would be, I would kind of hesitate you to see if something's sponsored by the NIH, that it's automatically good. I don't think that the NIH is, a nefarious place, but I think there's a lot of politics in who gets funded and how long they get funded and things like that. So don't see NIH and think, oh, this is perfect science. I think you can feel a little comfortable that it has gone through review and it's probably very, very rigorous, but still keep a little, a little voice in the back of your mind reminding you to really check over who funded it, where it was done. A lot of times, and I have no idea, even as an editor, I didn't know how to figure this out. Sometimes people in labs are married to each other, and so they support each other because they're also husband and wife, and those conflicts of interest are almost impossible to untangle, but those are out there as well. So it's a tricky field to navigate conflict of interest, but I think just going into reading a paper, keeping it in mind that things are not always as they appear would be a good strategy.
Thank you so much, Dr. McCartney. So it seems like our panel has done a great job of just like setting a foundation. And so I want to move it to more of application. And so I have a question here that says, so you're a new, you have a new student that's new to research, and they are having trouble kind of scoping down their specific research topic. So what are some of the ways that a literature review can help them scope down to that research question? And Umaro, can I start with you actually?
Yes. So many times I would say when you meet with your PI, they would be like, oh, we're interested in finding this out. So it would be just like an idea. And then the next question would be like, how? They're like, well, PubMed it. So I think the best thing first, what I always do is I go to literature reviews first, because those become a summary of whatever topic you have. For example, if it's a disease, I start with the disease. I look at the literature review of disease, and then after that, I look at the disease and whatever I'm looking for. For example, leishmaniasis, what I'll study. First thing I'll look at literature review of leishmaniasis. After that, I look at leishmaniasis and macrophages. After that, I look at literature review of leishmaniasis, macrophages, and something even more specific. Because then I could go down the line of more questions and deeper and deeper and deeper. By the time I actually get to the specific thing, the idea that we're talking about, I've already read like 10 different papers, and I already know what the disease is. I know what the different things are. And then I can actually synthesize some information and be like, okay, they did this in this paper, they did that one. And also when I'm doing the literature reviews, it allows me to keep a number of different papers that I found interesting just by reading the abstracts. Okay, I'll come back to that paper because it talks about this. I'll come back to that paper because it talks about this and that and that. And then by the end of it, by the end of the literature reviews, I have primary papers, I have other systematic reviews or literature reviews, and I have basically a list of authors that I know are quote unquote experts. Because if you see their names more than 4 or 5 times on the same thing, and they're publishing in like journals or like actually like impactful journals or something like that, and not just impact factor, but like impactful journals where they are actually disseminating information properly to the right individuals that need it. So I would say that's always my first step is literature reviews or systematic reviews, and then I look at primary papers because the primary papers sometimes are very difficult to actually to understand, and sometimes I have to read it 2, 3 times to actually make sense of what it's saying. So yeah, I hope that answers the question.
It definitely does. I want to have Olo talk about this a little bit.
So when you asked that question, I smiled because I had the recent experience about it during the summer. And I think I usually fall into that trap of thinking about this really lofty and grand idea. And then I realized that, this is not going to happen.
Yeah.
So just to give us a little bit of intro, I was looking at, there's a particular type of surgery in orthopedic that there's been a lot of controversy about as to whether or not patients should be discharged on the day of the surgery, POD 1, POD 2, or POD 3. So I was trying to come up with a way to figure out the data that I had to create a model equation that we can plug in factors and say, okay, for patient A, that's coming in with these variables, this is when they should go home. And I discussed it with my research team, and it was literally almost impossible. The statistician I was working with, he just told me, he said, if you solve this, then the insurance companies are going to come after you because that's what they are also trying to solve. And I literally just had 8 weeks with them. So at that point, I realized that it was literally impossible to do this. So the first thing you want to look at is to really streamline things into what you can do is, one, what's the data that is available? Like sometimes you have all these ideas, but the data to work with is simply not there if you are looking at a retrospective study. If you are looking at a prospective study, sometimes the data is just, there's no, it's hard to come by if you don't have a lot of resources at your disposal. Just yesterday, I sent an email to one of my mentors. We're trying to look at how we can assess the impact of social media on residency applications by next year for people who are able to match into residency programs. And my mentor was like, how do you want to do that? Do you want to start checking people's Instagram accounts? Do you want to check their Facebook account? Like, I don't know. So like with the resources, maybe someone who has resources elsewhere might be able to do that. But with the resources available to me as a medical student, I maybe will not be able to do that. You also have to look at the time available. What time do you have for this? If you're in high school, you probably have a lot of things going on. How many hours can you devote to this? That will help you to like kind of streamline to the area that you're able to do. And then usually when you do your literature review, it's best to concentrate on an area that is not much information out there yet. So you want to look for that sweet spot where people have, there's not a lot of publications on that, so that when you do your research and you write out a publication, journals will be interested in having your article in their journal because it's not something that there's a whole lot of information on yet. So I think those are usually the steps I take to kind of streamline. So back to my initial example, I realized I couldn't do that first thing. So I went back to my literature review and I said, okay, what's the next possible small step I can take in view of this grand vision that I'm hoping to achieve maybe in the next 10 years if I get the resources. So that was what I just worked on. Like, okay, this is where the information is now in terms of literature available. What can I do to move that available information just a little bit closer to the optimal place where I'm going to? So that's what I settled for. And that's what I was able to do. So usually that's helpful in trying to kind of like streamline things. I hope that answered the question.
It definitely did. Thank you so much. Did anyone else have anything to add to that?
Sure. Just quickly. So if a student came to me and like you said, if they're don't know even how to start, where to start, I think having that first conversation, and it has to be a gentle conversation, because I do recognize when students they have this, they have an idea and it's a grand idea, and sometimes you do have to say, well, let's just pump the brakes and let's start small. So I would have to have a conversation first, and then maybe give that student a review article that I feel is at their level. And if they can, again, tease it apart and find a good research question out of that review article, then I would say that they're ready for the next step. But I think if it's a student who's new to it, I would start gentle and start small, and then graduate, and then send them on their way.
A lot of us, like postbac and undergrads, really appreciate that. All right, so I'm gonna have Dr. McCarthy add something.
So I would piggyback on everybody by saying start with a review article, but I have a different reason why. I go to review articles because the reference section of review articles is anywhere from 50 to 100 primary sources that have been selected to be on that topic. So I think it's kind of an easy way to start your finding primary sources without necessarily going through a PubMed search. And the other thing with that reference list is usually the top 10 or so are kind of the landmark papers on that topic, because they'll be the ones that are cited first, the ones that have kind of changed the field, the ones that have introduced a new idea. Those will be cited, at the very beginning of the research article. So that's always kind of a neat trick to start searching for names of people who might be kind of the more prominent leaders in that field that you're doing the research on. It doesn't always work, but sometimes it does.
Thank you so much for that, Dr. McCarthy. All right, so I'm actually going to let Whitney field a question to you guys.
Great. So I did want to just hop on because I see one of my mentors hopped on, Dr. Segundo, who is a general surgeon. So if it's okay with the panel, I know that Dr. Richards and Dr. McCartney have been telling you why it's so important for research and how they're helping you understand it. But I was hoping that Dr. Segundo could tell you, as a surgeon, literally something that she literally had to look up the other day as a research article and use it clinically. And so I know a lot of us are either in medical school or pre-med. And so Dr. Segundo, to put you on the spot, I know you logged on to hear the information, but I would love for you to tell your story about why reading an article before doing a surgery is important.
Hey guys. So can you guys hear me okay? Yeah. Okay. So one of the big things is that you want to make sure that when we're looking at clinical information, does it change my practice? Does it guide my practice? Does it lead me to do something different than what I was already doing? And one of the things that, I'm not going to bore you too much with the details, but thromboelastography, known as TEG, T-E-G, is a type of study that we use to look at what part of the coagulation cascade a patient may have a derangement in. And the reason why that's important is because if you have a derangement, let's say, for example, in your platelets, for example, but you're only given packed red blood cells, you're giving blood, and the patient needs platelets, well, your patient is going to continue to bleed. So TEG, which is a really important test that we can use, we are trying to actually get it to be more available at our hospital. So I'm actually talking about it later this month. But one of the reasons why it's important is there was a study done back in 2013 that used TEG to determine at what point should you initiate anticoagulation after a patient comes into the hospital with like a blunt injury. So what that means is the patient had a car accident, or they fell, or they had something done and some sort of injury, and it was blunt. So that means not gunshot wounds, not a stabbing or something, okay? So any blunt injury, sometimes we're like, well, when should we start them back on therapeutic or even prophylactic anticoagulation? So this study actually used TEG, that test, to look at what point in the patient's coagulation cascade, after how many hours do they start becoming more coagulopathic? And they found that it was at 48 hours. So using TEG, we pretty much kind of changed our clinical practice to say, all right, if a patient comes into the hospital, whatever the problem, whatever the issue is, make sure that they are on some sort of anticoagulation within 48 hours. Because after 48 hours, their blood starts to clot more and they have higher risk of PEs, DVTs, coagulopathy in general. So that was I can't really share my screen, but there's and I could share it with anyone who wants that study, or I could even post it in the chat. But that was a great study that used a test to determine at what point, at what period of time, it's important to literally change our practice of keeping people, off anticoagulation. We found that not putting them on it actually was more detrimental than putting them on it within 48 hours. So that changed my practice. That study was actually when I was still a resident. So that really changed our practice even, in my program. So obviously I still do that now, but it definitely revolutionized a lot of our practices in the trauma and kind of critical care world.
Thank you. Thank you.
Thank you so much.
Oh, sorry. I just wanted to give a clinical perspective of why the things that our panel are, what they're saying and why it's important, because it literally is so important for anybody who wants to go into medicine and to stay up to date with information. You have to be able to do this. So I just wanted to find that direct link. Thank you, Dr. Seguner, for letting me put you on the
Absolutely. I couldn't find my lip gloss, but that's fine. We're good. We're okay.
And there's some people in the chat that wants to see the article if you would love to share it in the chat as well.
Absolutely.
Thank you so much. All right, so it looks like we're about to start winding down here. What we like to do at the end of these, we're in a time where things are kind of unprecedented. And so we want to give our panelists a time to just really encourage each person on the call and just kind of say one thing, whether it's a piece of advice or it is something that they can be doing right now to just stay connected, because, we have everything going on with the pandemic. So I'd love to just start with Dr. Richards and then work our way over.
So one tip, one example?
Yeah, it can be one tip, one piece of advice, whatever.
I would say try to get an RSS feed to your phone from either a journal or, a database that you're interested in, so that you stay on top of things. Get an RSS feed.
Dr. McCarthy?
I actually use Twitter to keep on top of papers. I follow journalists who usually tweet out titles, and I follow other colleagues in my field who are pretty good about sharing each other's work and letting other people know things that they're reading. I don't ever tweet myself. I'm a complete voyeur on Twitter, but I have found it very useful to learn about papers and current events in my field. My field's also probably a lot like medicine. It's so spread out. So I read papers in education, psychology, economics, sociology. It's impossible. It's impossible to keep up with all of it. And I think Twitter helps me a little. And it's pretty passive. I usually do it at night. If something like school, I'll email it to myself, and I'll do a bit in the morning. But that's my trick for trying to stay on top of things. Good luck.
Thank you. Thank you. Amaru?
So my advice is always the same. Get a mentor in different academic levels. If you're an undergrad right now, get someone who's in medical school, resident, and then someone who's an professor. Because what you'll find is these individuals are doing different things. Like medical students is, they just getting into the game and they're learning how to navigate the game. While residents, they've been navigating the game for a while, so now they're trying to figure out how to actually write papers, or they were even writing papers, but now they're trying to figure out how to be, like lead author or something like that. And then the attendants are writing grants, and all these different things will teach you a different way of assessing papers or assessing different stuff. And most importantly, they will tell you a lot. They will give you a lot of gems. And the other thing is get a mentor in whatever you're trying to do. If it's basic science research, get someone who's doing basic science research. If it's community health, get someone, because, you know, different fields will require different set of skills. You know, it doesn't hurt to have as many mentors as possible. They'll help you a lot. Yeah, medical librarian, because they will teach you how to use EndNote. I still struggle sometimes. And how to actually use PubMed appropriately.
And Olu?
Okay, I think the tips that I've been given are really wonderful. Just to add to that one, I would say be flexible. Sometimes you approach a mentor and you want to do A, and maybe your mentor is working on another project. You can just offer to help, and you know, you might be surprised as to what you get out of that paper. It might even end up leading up to what you really like, or giving you something that you're really passionate about in the future. So I found that that's really, really helpful for me. So just keep an open mind, be flexible, be mentorable. I don't know if that's an English word, but allow yourself to be pliable enough to be mentored, because you know sometimes some mentees are just kind of like ad fix, like this is it, this is it, this is it. Sometimes, you know, life doesn't really work out that way. And then this is just a personal advice. I know we had said this is a safe space. If you do believe in God, do pray to God. I found that that really works for me. Sometimes I just pray to God and say, God, just I don't know what to do. Just give me opportunities. And sometimes it could just be like grabbing a cup of coffee, or I just run into an old friend that says, oh, I know this person that can do this, and boom, everything happens. So, you know, just pray or ask God for opportunities, and you know, things will happen.
Thank you so much. Dr. Richards, did you want to talk a little bit about the medical librarian thing? Okay.
Yeah, of all the medical librarians I've met, they get really excited when someone gives them a question. When they say, can you help me? They will go out of their way to help you, because that's what they love to do. They love to collate, they love to search, they love to disseminate. So, you know, whether it's at your undergrad institution, even high school, you can contact your librarian. And I'm sure because they're a society of librarians, everyone knows everyone. So even if you're in high school, ask your school librarian. I'm sure they know someone who might know someone who is a medical librarian. So try to create that, that linkage, because trust me, that's what they do.
Dr. Richards, can I just echo that 120%? So literally, sorry, I'm just like jumping on here and I'm like, ooh, science, love it. So literally, like you have not gotten a good literature search until you've had a medical librarian do a literature search for you. They find articles from the souls of the internet that you would not find on your own. They do the best literature searches to the point where I'm like, as soon as I know my you know, the idea that I'm gonna look up, sometimes if I'm like, is this even a good idea? I'll contact a librarian and have her do a literature search for me and be like, you know what, there's really not a lot of stuff out there. This would be a great project. Or there's so much out there on this already. Let me maybe tweak it a little bit. So just to echo you are 100% right. Medical librarians are underused, but extremely valuable.
All right. I want to thank our panel so much for being here. You guys were amazing. You gave us amazing insights. To all of our participants and everybody that was on this webinar, we really appreciate it. This will be posted on the SNMA YouTube channel. And if you haven't seen our previous segments, they're already posted there as well. So you can kind of get caught up. And then make sure you're here for our next webinar. Also, at the top left, there's a QR code. If you guys could please take a picture of that and give us feedback. We need feedback and we love feedback. So yeah, thank you guys so much. We really appreciate it. And our panel, we hope you guys have a great rest of your week. And thank you guys.
So anyone can email me with questions. I'm happy to talk further. Are you sharing contact information?
Sorry, go ahead.
Go ahead,
put it in the chat?
Yeah, I was going to say, like, if you guys want to do it that way, I've also encouraged people to email me and I can field questions to you guys so you guys don't get bombarded. But before everyone logged off, I again want to thank the panelists as well. But since Dr. Sagunro is here, I did want to give her a chance to talk about the due influence, because I found a mentor on the due influence. I'm sorry, I'm putting you on the spot, but I know that everyone needs a mentor. We've been talking about mentorship. I know you have a platform to match medical students and pre-med students. And so for everybody here and for those on our recording, do you want to just talk about the due influence a little bit?
Sure. The Due Influence is an online educational platform that I started really just to help educate people in general, particularly about different careers from the people that are actually doing those professions. So the medical profession has the most number of people. I have a lot of physicians on there, nurse practitioners, PAs, nurses, you know, everything along there. And they have these about 10 to 15 minutes. I'm a little bit longer because I got really excited because I wanted to share so many pearls with you. Videos that are interviews that answer questions really about what they do. So if you're, you know, questioning, do I want to become a neonatologist or do I want to become an orthopedic surgeon? You know, these people are on there talking about them. They all happen to be my friends and wanted to do me a favor. But these videos are great if you're considering a certain profession. But also, majority of them have also said that I'm okay to link them up with students who want mentorship, right? That's a whole thing. Students sometimes don't have a way to get in contact with someone that they may want to emulate or be like, or just get more information from. So if you go to the doinfluence.com, click on the education tab, and if you scroll down, you'll be able to see where we have professional development. And there's a place that you can actually apply to become, you know, to get a mentor. So basically, you know, don't let the opportunities, you know, pass you by. 100% free, just something that I think is really important to get young people the information and the resources that they need that they may not be able to find otherwise.
Awesome, thank you. I'm sorry I keep putting you on the spot.
No problem. It's the doinfluence.com.
Awesome.
Yeah. Thank you guys so much. And make sure you guys do the feedback survey. We'll leave it up for a little bit.
Good. See you
Thank
next
you.
Bye,
for the
guys.
invitation. Thank you.
Awesome. Thank you guys. Thank you.
Thank you very much, guys. You guys were absolutely wonderful, and I wish you the best day, okay?
Thank you. Same to you, Tyler.
Have a wonderful day, guys.
Thank you.
Alex, did you stop the recording?